My friends, welcome to the interesting aspect of MD Crack series, that is MCQ discussion. So here I will discuss almost around 200 questions, almost 100 questions in the general pathology and 100 questions in the systemic pathology. So both are equally important. So I'll start the first session. This question is: most severe injurious stimulus to cell is? Options: hypoxia, ischemia, bacterial infection, vitamin deficiencies. So which is the most severe injurious stimuli? So if you go back and see the injurious stimuli to the cell injury, I have discussed in the cell injury chapter. Big ponic, that is the mnemonic I have made. So many bacterial infections can cause, immunological reactions can cause, even autoimmune disorders can cause, hypoxia, ischemia. Yes, in fact, all of these are the injurious stimuli to the cells. But which is most severe, you have to answer. What is hypoxia? Hypoxia is loss of oxygen supply. What is ischemia? Loss of blood supply. So whenever there is a ischemia, there will be not only lack of oxygen supply, there will be also lack of glucose supply to the tissues. Right? Yes, bacterial infections, yes, there are so many bacteria which are highly lethal, like our gram-negative bacteria, Proteus, Klebsiella, E. coli. We have a drug-resistant bacteria, Staph aureus, methicillin resistant. So they also can cause very severe injury. Yes, we have vitamin deficiencies, vitamin A, B, C, D, E. All those things cause the injury, right? But which is most severe form? Which is most severe injurious? Yes, it is the ischemia, lack of blood supply. It not only hampers the tissue oxygenation, it also decreases, it also hampers the glucose supply to the tissues. So in that way, ischemia is more severe form of injurious stimulus as compared to the hypoxia. So answer should be ischemia. Second question: most important target of a cell injury is? The options are cell membrane, nucleus, endoplasmic reticulum, mitochondria. You have to tell which is the most important target of a cell injury. Yes, we have the four options now. Cell membrane, which is very important for regulating the ions inside and out of a cell, right? That's also most important. We have the second option, that is nucleus. You know, nucleus is the master regulator of the cell. All the activities inside the cell is well controlled by the nucleus. That option we have. The third option we have is endoplasmic reticulum, the one which is very important for the synthesis of the protein molecules. And we have the mitochondria, that is powerhouse of a cell. So what will happen? Which is most important organelle that is very commonly get affected with the tissue injury? Yes, the answer is mitochondria. If there is no power supply, you will stop watching this video, right? Unless you have a backup of UPS, you cannot continue to watch a video. But we don't have a backup. There is only one powerhouse, that is mitochondria in our cells. They don't have any other backups, right? So the mitochondria is the first organelle that is get affected in the cell injury. But remember, all these cell organelles are in turn get affected later on, because the function of one organelle depends on the other organelle. What I mean is, the nucleus is dependent on the mitochondria. Mitochondria in turn depends on the nucleus. So there is a mutual understanding is there between these organelles. So they are dependent on each other. Injury at one locus can cause the injury to the subsequent organelles also. But the first and foremost important organelle that is get affected is the mitochondria. So it's an ATP depletion that occurs first in the cell injury event. So the answer should be mitochondria. Third question: light microscopy changes seen in a heart within 2 hours after an episode of heart attack. So you have a clinical scenario here. Patient has died due to the heart attack. What will be the light microscopy changes in the heart within 2 hours? You note down the time within 2 hours. Options: infiltration by neutrophils, infiltration by macrophages, Formation of granulation tissue. The D option, nothing. What do you think? We know that neutrophils are the first cells that will come to rescue. Whenever there is an inflammatory process is going on, the neutrophils are the first cell that will come to rescue. That is followed by macrophages, right? But the time given, you see there, it is only 2 hours. What will be the light microscopy finding? Do you think it is a formation of granulation tissue? Absolutely wrong. It takes very long time for the granulation tissue to occur. So do you think, yes, neutrophils, you know that they are the first cell to come, but they come within 2 hours? No, they will come only after 12 hours. So what will be seen in light microscopy? You will not see anything. So the answer should be nothing. My friends, neutrophils will begin to appear in the patient with a heart attack only after 12 to 24 hours. You cannot see any changes in the light microscopy in a patient who has undergone heart attack. Whatever you see the changes, that is very late. Light microscopy changes appears very, very late. So still late is the gross morphological findings. So the first thing that will happen actually is the contraction band necrosis. That takes almost 4 hours to see, that too in the electron microscopy. You cannot see that the contraction band necrosis in the light microscopy. So if at all you do, only after 4 hours, you may see some amount of coagulative necrosis and contraction band necrosis at the electron microscopy level. You cannot appreciate any changes in the light microscopy. So answer should be nothing. Nothing can be seen within 2 hours after MI. Right? Got the point? We'll proceed to the next question. Earliest transient change following the tissue injury will be neutropenia, second option neutrophilia, monocytosis, lymphocytosis. So which cells will come as the first cells as in response to the tissue injury? Quite easy to answer. Yes, what do you think? Neutrophilia. If you are thinking neutrophilia, then you are right. So it's a neutrophilia. So that's why, any infections, to confirm the infections, the physicians will send a blood sample to the pathology laboratory. For example, if the patient is having acute appendicitis, if there is a neutrophilia, that adds to their diagnosis. Yes, they are right. So neutrophils, remember, they are the first cells to come into the circulation whenever there is a tissue injury. Then comes the lymphocytes. Then comes the macrophages. Remember, macrophages are little lazy in that way. They take their own time to come, but once they come, they are very efficient phagocytic cells. Remember, we have 2 phagocytic cells. One is neutrophil, second is the macrophages. So neutrophils are also phagocytic cells, but the most efficient phagocytic cell is the monocytes or the macrophages, but they take their own time to come into the tissues. So what we see soon after the tissue injury is the neutrophilia. So that's why if at all you send the blood sample in any acute inflammatory process, you will see neutrophilic leukocytosis. WBC count will be raised, relative percentage of neutrophils will be raised. So answer should be neutrophilia. Fifth question, all the following statements are true regarding reversible cell injury except. Option A, formation of amorphous densities in the mitochondria, diminished generation of adenosine triphosphate, that is ATP, formation of blebs in the plasma membrane, detachment of ribosomes from granular endoplasmic reticulum. So let us see what this question is meant for. So the changes that are seen in the reversible cell injury are all except formation of amorphous densities in the mitochondria. So this mitochondria showing the amorphous densities, that is the first option. Second, diminished generation of ATP. Yes, mitochondria, they show ATP generation in decreased. Third, formation of the blebs. So blebs in the plasma membrane. Right? The fourth, detachment of ribosomes. So this is rough endoplasmic reticulum. So these ribosomes gets detached. So all of them are seen in the reversible cell injury except, yes, definitely as I told, ATP will be get hampered first. the first thing that will happen in this cell injury is the ATP generation is get hampered, so lesser and lesser amount of ATPs are formed. Yes, that is true. Second, membrane blebs are formed. That is also important finding in the cell injury, reversible cell injury, where you see formation of the membrane blebs. The cells will keep on swelling. It's all because of the influx of calcium ions and water molecules, efflux of potassium ions, right? And protein synthesis is get hampered because of the ribosomes. They will get detached from these molecules. Remember, the amorphous density formation. What is the alternate name for this amorphous density formation? Milind figures. Remember, these are called as Milind figure formation indicates irreversible cell injury. Remember, that is irreversible cell injury change that is not seen in the reversible cell injury. So, answer should be A, formation of amorphous densities in mitochondrial matrix, right? But remember, that is the electron microscopy findings. So, these Milind figures are nothing but the amorphous phospholipid concretions that are seen only with the electron microscopy. You cannot make out these Milind figures at the light microscopy level. But it is indicative of irreversible injury. All the following enzymes get activated with increased intracellular calcium levels. I told calcium is most important culprit in the cell injury chapter, right? So calcium, once it enters into the cells, it can activate so many enzymes. So all these enzymes will be get activated except ATPases, phospholipases, option C proteases, option D endonucleases, and superoxide dismutases. So there are so many enzymes. If you don't read these things, you cannot take a chance to answer these questions. So it appears very tough at this particular point, right? But remember, it is little easy. Whenever calcium enters into the cell, remember, it gets sequestered in two organelles. One in the mitochondria. Mitochondria, it gets sequestered, it gets more and more accumulated in the mitochondria. Second is the endoplasmic reticulum. So calcium is very important culprit in the cell injury chapter. So once calcium enters into the cell, it activates so many enzymes. ATPase are the one which will break down the ATP that are synthesized by mitochondria. Yes, that's correct option. Phospholipases, they are the one which will break down the cytoskeletal membrane. The protein network, protein cytoskeleton is broken down by activation of the phospholipases. That also will be done by the calcium ions. Proteases, again they are also important for breaking down this cytoskeletal protein. Phospholipases, not only that, they will also break down this phospholipid layer. Not only cell layer, individual organelles also will have a phospholipid layer that is also broken down into pieces because of activation of the phospholipases. Then the fourth enzyme, endonucleases. So that's an enzyme which will break down this DNA. DNA undergoes fragmentation. What you call this? Fragmentation of DNA, it is karyoregesis that takes place. That also will be done by increased levels of the calcium ions. See the fifth option, superoxide dismutase. Do you remember? That is an antioxidant. Yes, that is no relation with the increased calcium levels. So remember, the four enzymes that get activated are ATPase, phospholipases, proteases, and endonucleases. The answer should be superoxide dismutase, which is important antioxidant. So that is the answer, right? Proceed to the next question. Cell injury occurs due to all except decreased ATP, increased cytosolic calcium, membrane damage, mitochondrial dysfunction. Fifth option, increased intracellular potassium ions. Which is the answer? Straightforward. Just a little bit think. Decreased ATP, yes, because of mitochondria get affected. Increased cytosolic calcium, that's what I told. Calcium is very important ion that causes the damage. Membrane damage because of the activation of the phospholipases. Mitochondrial dysfunction because of the ATPase are synthesized once the calcium enters into the cells. Increased intracellular potassium. No, potassium goes out of a cell. So what ions will enter into the cell? Calcium enters into the cell. Along with the calcium, water molecules will enter into the cell. That's why the cells will keep on swelling. So the cell size increases. But important ion that goes out is the potassium. Potassium goes out of a cell. The answer should be increased intracellular potassium. So there will be a decreased actually. Right? So answer is E. Which of the following is not a cell adaptation? You know the different types of cell adaptations, I hope. Hyperplasia, that is increase in the number of the cells. Metaplasia, where one type of cell is totally converted into another adult epithelium. Dysplasia, disordered arrangement of cells. Metamorphosis, what is that metamorphosis? It is total conversion of one type of epithelium into totally another type of adult epithelial cells. So it is little different from metaplasia. Example for metamorphosis, imagine the cirrhosis cases where Ito cells, vitamin A storage cells, will be converted totally into different types of cells, that is myofibroblast, and then keep on secreting the collagen. So that is the example of the metamorphosis. Then neoplasia. What is neoplasia? New growth. New growth, that is not a type of cellular adaptation, right? So hyperplasia, metaplasia, dysplasia, metamorphosis, they are all the cellular adaptations. Actually metamorphosis we will not usually include in the cellular adaptations, but neoplasia is not at all a type of adaptation. It is totally a wrong process that is going inside the body. So don't think neoplasia is adaptation. It's not. So neoplasia should be the answer, right? Yes, it is the neoplasia. Yes, we have a clinical scenario here. Use a similar type of question. A 50-year-old man had a long-standing hypertension and chronic renal failure. He was not on regular medication. He died from heart failure. Autopsy, he had a large heart and weighed up to 540 grams. Size of heart is most likely to be result of which of the following process involving the myocardial fibers? Choices are hypertrophy, hyperplasia, fatty infiltration, fatty degeneration, liquefactive necrosis. So this is a case of long-standing hypertension and not under control. So if at all the person dies, what will be the scene? So the weight is, see, the 540 grams is there. So heart is really large. So normally it will be around 450 grams. In females it is less, around 350 grams. But here 540, that's almost, it is increased in its weight. So what is the changes? What do you expect? Hypertrophy. If you are thinking of hypertrophy, you are right. So it is a left ventricular hypertrophy. Second option you see here, hyperplasia. Don't expect hyperplasia in the heart because heart muscles cannot divide further. So never expect hyperplasia. Fatty infiltration, yes, it occurs whenever person will be of long standing starvation. Then there is a change of fatty change can be seen even in the heart. We see so many autopsy cases where fat is getting infiltrated in the heart and we call it as tiger defect of a heart. We see alternate yellow colored band and brown colored heart. So tiger defect is seen in the fatty changes in the heart. So that is not due to the hypertension. Fatty degeneration, no, it's not an answer. Liquefactive necrosis never takes place in the heart. It's only coagulative necrosis in the heart. So answer should be A, hypertrophy. Yes, left ventricular hypertrophy, very common entity in the untreated hypertensive patients. Last question of this session. Which of the following cellular adaptation can lead to neoplasia? So we know that we have a different types of cellular adaptation, but some of these adaptation can lead to neoplasia. They can even turn into malignant if you don't treat them. So let us have a look. Atrophy, decrease in the cell size, as well as organ will undergo decrease in the size as such. Hypertrophy, increase in the cell size, organ also will increase in size. Hyperplasia, increase in the number of the cells. Metamorphosis, as I told, example, only one example, that is Ito cells will be converted into myofibroblast. So which one do you think can lead to neoplasia? Yes, atrophy, hypertrophy, they are not much problematic. They will not cause any neoplasia. Its answer is hyperplasia. So remember, hyperplasia is the one which can lead to malignancy, because hyperplasia is most of the time it is related to the endocrine effects. So it can lead to, for example, that's what happens in patients with benign prostatic hyperplasia, and even with the endocrine stimulation like follicular hyperplasia. Most importantly, it is the endometrial hyperplasia. If at all it turns into the complex atypical hyperplasia, then there is very high chance of development of the endometrial carcinoma. So answer should be hyperplasia. Yes, answer is C. Remember, hyperplasia, metaplasia, dysplasia. All these three are actually types of cellular adaptations, but they can lead to development of the malignancies. Hyperplasia, example, best example is the endometrial hyperplasia, atypical endometrial hyperplasia, especially if it is complex, can lead to endometrial carcinoma. Metaplasia, example, Barrett's esophagitis, where it can lead to the adenocarcinoma of the esophagus. Dysplasia, where we use this word dysplasia very commonly in the uterine cervix. So CIN carcinoma, cervical intraepithelial neoplasia, that is CIN changes, or mainly it indicates the dysplastic changes. So that can also lead to the squamous cell carcinoma of the uterine cervix. So remember these three adaptations, cellular adaptations, when the irritation continues, when the irritant continuous chronic inflammation will continues, it can turn into the neoplasia. That's about the first session. We will continue the interesting MCQ discussion in the second session.